I'm now going to demonstrate administering an IV piggyback medication through an existing IV line. I've got my medication sheet, my MAR, and the order is for SCF 500 milligrams in 100 milliliters of normal saline every 8 hours, IV piggyback every 8 hours. And the patient has an IV, and it's D5.5 normal saline at 100 milliliters an hour. So the first thing I want to do is look up my medication and find out all the things you need to know about any medication, the action, side effects. Important with an IV piggyback, you need to know how fast you're going to administer the antibiotic. And we've determined that the SCF is going to be given over 30 minutes. And the second important thing is if you're going to give it through an existing IV line, is it compatible with the medication, the primary IV line? And we look up compatibility and find out that yes, it is compatible. So I look through my medication drawer or wherever I'm going to get my medication and come up with my SCF 500 milligrams in 100 milliliters of normal saline. I do my first check. Patient is crisscross. Check allergies. He has no known allergies. That's really important with antibiotics, which most IV piggybacks are antibiotics. Other things are given IV piggyback too, but most often it's antibiotics. Because it's going into a primary IV site, IV line, it's actually considered a secondary IV bag. So what I need to also get is a secondary IV medication tubing. So I've got my antibiotic, I've got my tubing, I've got my MAR, and now what I'm going to do is grab an alcohol swab, which I will need, and prepare my IV piggyback medication. I can do this in the medication room or in the patient's room. Usually you do it in the medication room and then bring it to the patient. So I'm going to open my tubing. And your secondary medication tubing is short. It's not like a primary tubing, it's a shorter tubing. Because it's actually going to be plugged in at the port closest to the IV bag when you go into the patient's room. So it's a short tubing. First thing I do when I open it up is remember that closed spike squeeze. Take the roller clamp, close it. And then I'm going to spike my medication, but before I do that I want to do one more thing. There's a alligator clamp that goes at the end of the secondary tubing, and I'm going to put that on, keeping the tip sterile, so I can prime through this. Just put that on gently, you don't need to go real tight with it. Now I'm going to do a second check, my SCF 500 milligrams and 100 milliliters of normal saline for a crisscross. Remove my spike, and then spike my medication. This is because we're in the lab just as a whole, but you would probably have to flip the top off the medication. And now I'm going to turn it over and prime my tubing. Now if you hadn't closed that clamp, your fluid's going to be pouring out of your tubing, and you only have 100 milliliters of solution, so you could potentially lose half of your drug if you did not have your tube clamped. And now I'm going to prime my tubing. So I need something to prime it into. I've got the trash here. Take my cover off the alligator clamp, hold it in my hand, and squeeze the drip chamber so I don't get any air in the tubing, and slowly prime the tubing. Again, you don't want to waste any of this because it's medication. Just to the end, okay. Recap. And then if I were in the medication room, another thing that I would want to do is take a tape or some kind of identifier of when I hung this, when I put this IV piggyback tubing onto the medication. Usually tubing, just like the primary tubing, is good for 72 or 96 hours. So we want to document when we put that up. So I've got the time, the date, and my initials on that. Okay, now I've washed my hands, I've got the medication, I've got the MAR. I don't particularly need gloves for this because I'm not going to actually be down at the site with, where I could be exposed to body fluids. I also have a hook that I'm going to use to start my secondary medication. So I'm going to take all this into the room. I come in the room, use 2 identifiers for the patient, do my 3rd check with the medication. Now the IV is running at 100 milliliters an hour, which is about 16 drops per minute. So it's already running. I'm just going to leave it running for right now. But what I'm going to do is take this hook and I'm going to take the primary IV bag, put that blue hook through there, and hang it lower. Now, of course, for demonstration purposes, these are real close. In reality, this would be down flat and the bag would be higher. But just to get them in the video, that's why it's like that. And now I'm going to hang my secondary medication. So this is going to be at the highest level. Still got that closed off. I'm going to take an alcohol swab, clean the port closest to the primary IV bag, remove my cap, and plug in the secondary medication. I've assessed the site, made sure there's no infiltration or redness. It's not required to aspirate for a blood return, although some policies might say that, but most often it's enough just to assess the site for patency. Now this is running at 16 drops per minute. I want to reset the rate. We have an IV piggyback 100 milliliters over 30 minutes. So the way that I calculate that, and I have my calculator, it's 100 milliliters times the drop factor, which is 10. If you look on the bag, it tells you the drop factor is 10. That equals 1,000. And then we're going to divide that by the minutes. And we've already said that we're going to give this over 30 minutes. So if we divide by 30, that's going to be 33 drops per minute, which every 15 seconds is approximately 8 or 9 drops every 15 seconds. So what I'm going to do, the roller clamp to the secondary IV piggyback, this is important, just open it all the way. You're not going to regulate this IV with this roller clamp. You're going to regulate it with this one. So now I'm going to set my drops per minute at approximately 8 every 15 seconds, or 32, 33 per minute. Okay, and there's very little fluid, there's not 100 milliliters in here, so for demonstration purposes I left it like that, because what I want to show you is after this is done dropping and is empty, I'm going to speed it up a little bit. I want to show you what happens. This is not running while that's running because of the way the pressure is. The pressure's up here. Once that fluid comes down to about here, this is automatically going to start dripping. So your IV does not stop after this is done. This one will just take over. But it's going to take over at the rate that you set this one, which, if you remember, this was at 16 drops. This was at 33. So this is going to be going twice as fast. So after the 30 minutes is up, you come in and you see that this one is dripping. This one's completed. What you're going to have to do is raise your primary IV bag and then reset your drops per minute after you close your clamp, close your secondary clamp, and reset your drops per minute at the initial 16 drops per minute. Okay, and that's administering an IV piggyback through an existing IV line. I do want to show you one more thing. If you have multiple, usually IV piggybacks are every 8 hours or every 6 hours. If they're antibiotics. So you may, in 8 hours, you're going to leave this hanging there because in 8 hours you're going to reuse this tubing. Some places do what they call a back flush or a back prime, and I just want to demonstrate that for you. The way that you do that, let's say that I'm coming in and I'm going to hang another antibiotic, either the same one or a different one after a few hours. What I'm going to do first is back prime the tubing. So I'm going to take the tubing on the secondary, hold it down low, and open this all the way up. And if you see that, I don't know if you can see it on the video, but it's full blast. It's basically just flushing out this IV line. Once it's flushed, I'll close it. So now I have all the IV fluid in there, which is compatible with whatever I'm going to hang next. That's important. It has to be compatible. Now that I've done that, I'm going to take this off. And then hang my next antibiotic. And start the process over again. That's called back flushing. Not another method, but another alternative to that is also back priming. And the only thing that is if you have an empty tube, you plug it in with your antibiotic at the end and you back prime it this way. Rather than holding it up and priming it, you can do it, hook it up and prime it this way. Okay, that's it for IV piggyback through an existing IV line.